want to get a
Happy to
little
be here.
of your background and your practice, and then we'll get to the fundraiser you want to do to what? To raise awareness for skin cancer, and you're going to do this in the Taberna area. We're going to get
Absolutely.
to that.
Okay.
But your background, how long have you been in the area, and how'd you get here?
Well, I've been here just a little bit over 2 years, and originally from Cincinnati, Ohio, so grew up in the Midwest, and did my residency training at Wake Forest University in Winston-Salem.
All right.
So after spending 6 years there, my family, we just fell in love with North Carolina and thought this is the place for us.
So did you put Cincinnati on one side of the sheet and then North Carolina on the other side of the sheet,
Exactly.
Doctor?
Yep, and there were a lot more checks for North Carolina.
Well, we're the winners. We're the North Carolina, the winners. And your office, tell us a little about what you do and where you're located.
We're on News Boulevard. The address is 2021, right across from the hospital, Carolina East Hospital. And we pretty much do everything. I split about 50-50 between cosmetic surgery and reconstructive surgery. And I actually have a joke in my office. I tell all the new employees, if anyone calls on the phone and they ask if we do something, the answer is yes, we do it all.
You do it all. You really do, huh?
Pretty much. And plastic surgery is very much a field, a very broad field, where head to toe, we can work on it reconstructively or cosmetically.
Have you always, you know, when you were a kid, you know, is this what you wanted to do when you grew up or not? When did the epiphany of
I've always been an artist, actually, and I minored in art, and I knew I wanted to do something with science, but that was always kind of my hobby. And I didn't know about plastics until medical school, and I did a rotation in it, and I said,
really?
that's it. I figured it out.
Do you do more reconstructive?
We do about 50-50, maybe a tiny bit more cosmetic, but you know, facelifts, tummy tucks, all that kind of stuff. And then reconstructive is skin cancer, breast cancer, wounds, lacerations, traumas. So it's really a good mix.
You change people's lives in a positive way, and this would be the most positive way, I think, the reconstructive.
Absolutely. It's the most. It's all very gratifying, but when we talk about the skin cancer part coming up.
Let me mention that 94.1 WNBU is rejoining the Phil Knight program, and Dr. Zannis is with us to talk about a skin cancer awareness fundraiser coming up in Taberna in the very near future. But go ahead. I interrupted your thought.
Oh, sure. We were just talking about reconstruction, and some of my greatest patients are the guys or gals who come in with big skin cancers. We take them off ourselves, but we also work closely with the dermatology folks.
You do.
And they'll do something called Mohs surgery to remove a skin cancer from the face, for example, and then I'll help them to reconstruct it. And those guys are very grateful and become big advocates of skin cancer awareness. In their 70s and 80s, start talking about it to all their friends.
Now, in this day and age, the advances in medical care in your field and other fields is mind-bending, is it not, with equipment and robotics and with everything else and laser or whatever? I'm throwing out terms here that I barely know what they mean, but it's amazing, isn't it?
Absolutely. It's constantly changing, you know, and a lot of it's nanotechnology and gene therapy and things that I hardly know about, but got to stay up to date. And the main thing is going back to the basics. Protection and prevention is always what we talk about.
Okay, we'll get to the fundraiser, but is it lying out in the sun with skin cancer? I mean, is that the deal? And you see kids today, I know our daughter and our daughter-in-law, they soap up their kids, our grandkids, before they go to the beach and stuff. Talk to us a little about what the real thing is.
Sun is probably the #1 risk factor.
Okay.
In this country, every year about 3.5 million people are diagnosed with a skin cancer. It's the most common cancer there is in the country. And
it is the most common.
Most common. As common as breast, colon, lung, all put together. And so prevention is very important. Exposure to sun in childhood. If you've had one blistering sunburn in your childhood, you're twice as likely to have a skin cancer in adulthood.
And who hasn't? In my generation, you're younger than I, doctor, but who hasn't? You know what I mean? I mean, we didn't know about this in the 50s and 60s, really.
And that's what a lot of people who come to see me say. You know, I used to put on the baby oil or whatever and just bake in the sun until we found out about how detrimental UV radiation can be. But even today, with all the knowledge, I have patients come in who've been to the tanning booth.
Yeah, I wanted to ask you about tanning booths too. I don't want to go against tanning booths, but
Sure.
who would do this today?
Well, I guess still people don't really believe it or aren't really aware of how dangerous it is. And
Is there a genetic hookup also? Is sun the main factor, doctor, but what else?
There is a genetic hookup, especially with some things they're looking at potentially with melanoma and more serious forms of skin cancer, which can be lethal. The common kinds, although they're not very lethal, can be disfiguring if you let them eat away at your face or wherever. But there is a small genetic component, but sun is the #1 thing, and that's why we talk about it so much.
All right. Well, the 22nd, Saturday, September 22nd, a week from Saturday.
Correct.
You have a fundraiser coming up in Taberna. This is to raise awareness, to raise money on skin cancer. Talk to us. Where did the idea come about? Where's it going to be in Taberna, and how's it going to work? Yeah.
Well, since we see so many patients with these problems, we're thinking, well, we need to do something to bring about awareness in the community. And a lot of people are into running in this area and walking. I'm personally not a runner, but I like to walk. And come on out on the 22nd. We're going to have walking, running, jogging, families, kids, and just have a good time. And all proceeds, net proceeds of the fundraiser, will go to the Skin Cancer Foundation. So it'll be $20 to register. You'll get a T-shirt, refreshments, and just have a good time. And then all that money will send to Skin Cancer Foundation. So
it's going to be a series of events, a walk, a run, with kids, families, everybody, right?
Everybody. And it's just a 3-mile loop around the Taberna Circle, so it's pretty easy and benign, and hopefully we'll have good weather and just enjoy ourselves.
Wonderful, wonderful. Will you have any talking about skin cancer, or is this simply to raise awareness and funds for it?
It's mainly to raise funds for it. I will be there the whole time talking with people, and we'll have some of our previous patients who've had cancer and reconstruction there talking about their experience, and we're going to try to give out some free sunscreens and just have it on people's minds.
Have it on people's minds. All right, and it's a week from Saturday, the 22nd. And again, what are the hours, doctor, and how do they register? Do they need to pre-register?
Registration starts at 9 a.m., and the actual event will begin at 10. So anytime between 9 and 10, if you show up, you can register on site or call into my office ahead of time and pre-register. Pre-registering will help guarantee you'll get a T-shirt or something like that. But just come on. Last minute is fine, and we will be happy to see you there.
Okay, just fun, and it's at 9, but then the event starts at 10, basically?
10 o'clock,
And how long, it'll go 2-3 hours, I'm guessing?
Probably about an hour. I mean, the actual loop would only take 5 to 10 minutes for a jogger, a half hour for a walker, and then we'll stick around and have some refreshments and just talk with anyone who wants to
refreshments and talk. And where's the start-stop point? Is it the country club?
Country club, exactly right. Yep.
Okay, which is, they've done that before. It's a beautiful place to do stuff like this. We've done some walking and running around there, and it's a beautiful place to do it.
Yep, so, it's great.
All right. We'll continue to mention this a week from Saturday. Just show up or pre-register. And again, did you say $20? Is that what you said?
$20 minimum. You can, of course, donate as much as you're willing to.
And where does it go directly to, you said?
The Skin Cancer Foundation, which is skincancer.org. And they're the biggest skin cancer organization for research and awareness and all that.
So the money goes straight to where it ought to go. Well, it's a great idea, Dr. John Zannis. Thank you very much. You're headed to your office as we speak?
I sure am.
All right, we'll drive safe. But it's great to meet you. It really is. I hear such good things around the community, and it's a pleasure to meet you.
Pleasure to meet you, too.
Appreciate it.
All right.
All
right.
right. Have a good rest of the day, and say hi to your family. You got 3 kids, right?
3 kids. Gabriella, Alexander, who turned 4 yesterday, and baby Christopher, who's 3 months. Almost.
Hang in there. All right.
Good
to see you. All right. We'll be back in a moment. Don't go away.
If you're going to court, it's important that you hire an attorney who has been